This is Tulio Siragusa with Dojo Live. Today is Thursday, November. What is it today? The second? Oh, the third, guys.
I think it's a
December.
third,
The
third actually.
December 3rd. Hey, welcome back. We have another awesome guest today. Before we do that, I want to just welcome my co-host, Carlos Ponce from Cuernavaca, Mexico,
Hey, thank
and
you.
Kim Lantis from Hermosillo. Hi, guys. Welcome back. I'm broadcasting on my cell phone today because my computer decided to reboot in the middle of the broadcast. So here we go. Let's have some fun with this. Why do we do this? We do this because we want to talk to our guests. And we have Marc Polimeri, who's joining us today. We're going to be talking about AI and specifically about the doctor-patient engagement. But before we go into that, let's get to know Dr. Polimeri a little bit better. Please tell us a little bit about yourself.
Tulio, Carlos, Kim, thank you very much. It's a pleasure to meet you all and to speak with your guests today. I've been a physician for 30 plus years here in the state of New Jersey, practicing primary care medicine. And, it's interesting. I had to create an avenue for patient records back about 18 years ago that began to transform my practice from paper charts into what was really one of the first electronic health records, or EHRs, in the area. I vastly was ahead of the curve in implementing this in the practice, and my short-term goal for doing that and my necessity for doing that was really a financial one. The costs of doing business and the amount of papers and charts and staff that we had in what had grown into an extremely large practice at the time was consuming me, and it was consuming pretty much the overhead was outgrowing the pace of the practice. So we enabled this electronic health records, and fortunately, in a matter of an 8-month period of time, we were able to have a return on investment of about 90%, and it proved to be a very beneficial thing. Although at the time, I barely knew how to turn on a computer, but we learned and we worked with it. Fast forward many years later, I was actually caring for my mother, and she had, in her 80s, suddenly developed heart failure out of the blue. And in the necessity to rush her to the hospital and have a cardiologist see her, very quickly I began to realize, we have no access to this electronic health record system that exists in this little silo of my office. And despite that, we were able to get my mom stabilized and initially treated, but she had to be then transferred to another facility, another larger hospital in the New York, New Jersey area for this subemergent heart surgery, which I'm pleased to say she survived and survived well. Upon transferring her to the other hospital, all the tests, all of the things that were done to save my mother's life in an acute manner had to be repeated at a hospital that was about 5 miles away, because there was no interoperability, no access or sharing of records on the very same individual patient that we were all trying to save the life of. And right around that time, my daughter was doing an exchange program. She was in college and she was traveling through Italy and having probably more fun than she should. And I was able to access anytime she spent money. I had it at my fingertips. It was on my phone. It was on my email. I just knew what was going on. And I began to realize for the first time the frustration that really we have lagged behind in medicine in a horrible way. Now, I'm not a tech guy. I'm a hardworking internal medicine guy, but I know exactly what takes place whenever you have to treat a patient. So, born out of this frustration and what I felt was a real personal pain, I began to architect out what wouldn't be necessary to connect all the different dots, all the different pieces, whether it's laboratory information or consultative work or hospital work. Could we connect this into one digital platform and then create something that was meaningful to share between a doctor and a patient, or the patient and the doctor? Because maybe your experience holds true to this. Any patient who does well, any patient who really embraces their health and really owns their willingness and desire to be healthy and stay healthy, requires understanding. So if we can impart this knowledge to them in a meaningful way that is meaningful to a non-medical trained person as well as to a medical trained person, then we could then we've got all the pieces of the puzzle. And it may be a longer answer than you were hoping for, or longer entree than you were hoping for. But this is in a nutshell the passion that drove me and created the environment that became what is now trademarked as ChartDoc.
What an amazing story. It's always amazing to hear founders of companies that created something either out of frustration or need or some personal pain that they experienced and didn't want anybody else to experience that too. So congratulations for creating that. Tell us a bit more about ChartDoc. How long have you guys been in business? What do you guys specifically offer?
Sure. So we finally incorporated as an entity in 2014, where I began to pull investment money together and a little bit of mine as well, and begin to pull in some of what we call the right people. I've got some amazing technicians behind me. I have a UX designer from heaven, I believe, and we began to take what was initially a napkin drawing and this huge roadmap of how all the data needs to translate and be shared throughout this system of creating one patient encounter. And we began to write code. And I will tell you, repeat again, I am not a techie. So of course, you start with what you think is right, and you're taking what you think is the best advice, and you then have to toss that all away, and with that, goes some of your revenue, and throughout the process of making mistakes, rewriting, restructuring databases, and creating these digital plugins, if you will. We began to create what is a system that is actually going live on December 15th. So we're really, really excited about this. If I can speak in a little bit more detail so I'm not so abstract. One of the things that I envisioned, and this was really literally with a felt tip pen on a napkin over a beer. I began to sit down with my UX designer, who's a very dear friend, and I imagined how we could take something as complex as, let's say, the statement of acute coronary syndrome, right? My mom doesn't know what acute coronary syndrome is, but she knows that she pledges allegiance to the flag by putting her hand over her heart, and she has an idea where her heart is. So what we did is we came up with a three-dimensional avatar of the human body and began to map via diagnosis codes the ability to tag all information, whether it's X-ray or EKG or a doctor's notes or a prescription, etc., and literally pin them to the human body, much like Apple or Google will pin, let's say, pictures from my vacations, when I went out to LA and when I traveled most recently to Arizona, all the pictures that I've taken miraculously just automatically show up on this map. And what we've done is we've been able to now map to the entire human body, and the avatar now has evolved in such a manner that this was actually developed by a company we partner with here in New York City, who's developed the initial version of this avatar as a method to teach medical students the ability to understand and dissect the human body. So it's completely anatomically correct, whether it's male, female, young, old, and we're able to put all this information there. So it's an engagement tool that rather gamifies, if you will, the ability for a patient to play with. Actually, they play with their records. So oh, look, click. I can tap over my belly and there's all the information from my appendix surgery.
Amazing. Sounds amazing. All right, so let's learn a little more as well as how AI plays a role in all this. Kim, will you please introduce the show today? Let's go right into it.
Sure. Thank you, Tulio, and thank you for being here, Doctor. As we mentioned, empowering the doctor-patient engagement with AI is today's topic, with the tagline of complete digital transformation of the doctor-patient connect. So I'm really understanding that you're using this avatar and your technology to make a patient's condition much more understandable to themselves, right? I think I can acutely relate to this myself. 3 years ago, I actually had a premature birth with my daughter due to, oh my gosh, now I'm having, I can't think of the word in English. I only know the Spanish term. Yes, thank you, which escalated to eclampsia. And then I had the complication of it turning into HELP syndrome, actually. Spent over a week in the ICU and all this other stuff. Of course, I wasn't in condition to necessarily be paying attention to such things at that moment. Later on, of course, as I was recovering, I really did appreciate just the empathy and the willingness of my personal doctors to really explain my situation, what had happened, what will continue to happen, what this recovery is going to look like. One of my questions for you is, what about privacy issues in the sense of, as I'm in the ICU, let's say, and I'm neither here nor there, but my husband is very much interested in what might be going on with me. Do you anticipate having any type of overlap, not just with the direct patient and doctor, but perhaps immediate family members or caregivers that might need that information as well?
I love you for this question. I really do. So privacy of your healthcare, Kim, is absolutely the most sacred thing that a person needs to be kept close to them. And even more so than financial information, your health information is the most private. And in fact, we've been able to be fully HIPAA certified, as well as the equivalent of the privacy of the information for Europe. So the way we enable the privacy is much like it's done today, except it's done digitally. So your information, when you go to a doctor currently, the doctor is basically handing you a privacy form that's stating all your information about you remains under his lock and key, and will be shared with no one unless it is by your written request. And that's basically HIPAA. So since all this information, and maybe I should have been a little bit more clarified on this earlier, but since all this information that we get and tag to the human body becomes your personal information, because when the HIPAA law was signed in 1996, requiring doctors to keep your information private, at that exact moment, the ownership of that information then became your personal property. So all this information now is your property, and we do this all on your behalf for you. Now, when you decide to share this with your husband, because you would choose to, you would grant him the credentials to do so. When you choose, let's say, me as your primary care physician, the ability to view your chart, you would then, I would then, with my credentials, be able to view your chart as opposed to, let's say, Carlos's chart, who has not granted me permission. So privacy, by its very nature, has been built into this system by design. It has to be. Does that answer for you?
Yes, it does. Thank you.
Okay.
And I think that brings me to my next question. So the primary user of ChartDoc is the patient itself, and the patient is going to be sharing this information with their caregivers, with their physicians?
So no, actually.
Okay.
So this is a full engagement panel. This is not an app. This is not just a simple little computer software system. This is an enterprise system. So we, when I say we're going live on the 15th, we're going live with the full doctor's version. So the doctor's version now is able to take all this information that I just artfully described, is tagged for a patient to understand, and is displayed for him, while simultaneously giving him the ability to add more information, clarify more information, attend to a person's health, etc., much like a doctor uses his EHR platform in their offices today. So it is a tool that not only gives information to the doctor and to the patient individually, but it also creates an engagement between the two. And one of the things that, for example, that we use the avatar for is, and we're actually completing this module as we speak. Let's say someone has the common diagnosis of high blood pressure, right? It's called hypertension. While in the doctor's office and also on their own portable, comes up just when they see this diagnosis, it automatically loads a full video tour of all the aspects, and it's all done graphically. So this is something that it's not like we're trying to teach somebody internal medicine or cardiology, but it gives a graphical description of what is high blood pressure, how does this affect your heart, what happens to your blood pressures, what happens at your level of your kidneys, et cetera, et cetera, et cetera. And it's very detailed and very comprehensive, and it's pretty amazing. So the tool itself of ChartDoc, think of it as a giant enterprise that allows doctor-patient interaction, patient knowledge, doctor knowledge, and then governance across the whole thing. So that, and this is where now AI starts to play in. So the artificial intelligence aspect of this is really multi-tiered. One of the things we're...
So Marc,
go ahead, I'm sorry.
Just very quickly, just to clarify on that
Yep.
question. So it's a value-added service that a medical practice would provide its patients with ChartDoc as a way to engage with their patient, provide them insights and knowledge and access to that kind of information. So as a practitioner who has maybe a practice or multiple practices, I license this technology and my patients have access to it and my doctors have access to it, and that enhances the relationship I have with them. Although I do love the question that Kim asked, because like as an individual, I would love to have a portable version of that. So when I go to another practice, if they don't have that software, I have it. But let's go into how the AI comes into it. Maybe that's next version.
And Tulio, yes, it is fully mobile. Everything exists in the cloud. So, yes.
So as an individual, if I change practice to go to another doctor, I could essentially say, hey, I have all this information, which becomes another way to introduce it, I suppose, to the new doctor or the new practice, that this technology exists for them.
Absolutely. So what it does is it gives, again, so Tulio, let's say you had ChartDoc. So whether Tulio stays in LA, or you come back to New York, that information is with you. You own it. You own it. Okay.
Got it.
At zero cost to the patient, but you own it. Now you begin to, develop a relationship with a new doctor in a new location or in the same location. Makes no difference. It's all encrypted. It's all in the cloud. It's all private. And you, as the owner, make the determination on who sees this.
I love it. It's like my personal Dropbox for health.
Yeah, it's a way to put it.
And I think that
I got a question
go ahead,
here.
Carlos.
Yeah, it's just that I'm listening to you, and I cannot help but going a little bit deeper into the guts of the project, of the platform. I'm sorry. And my question is this: because you're a medical doctor, so you're I'm assuming that you're trained in science and biology and anatomy, basically
Just
science,
a little.
right? Yeah, just a little bit, right? So how does the doctor, and this is like the curiosity that I have, right? So how does a doctor with such training, which usually takes a long time, get into how can I say this? Get into the tech aspect of building a platform. I mean, you conceived the idea, you conceived the service, you saw actually from your own experience, based on what I heard, you conceived you had a problem or a situation, and then you conceived a solution for the situation. Now, how did you make the leap into the tech part? How did you fulfill that tech component? Did you train yourself in tech matters, or did you work with others? How did this come about? I'm just curious on that aspect of the equation, if you don't mind elaborating, please.
Yeah. Carlos, the key factor here was initially, I didn't know enough to know what I didn't know, and my ignorance in what it took to build was enough to allow me to take the leap. If I knew maybe back in 2014 what it would take to actually do this,
Mm-hmm.
I might have hit myself in the head with a brick and stopped right there. But
I love that.
But honestly, when you don't know what you don't know, stupidity can prevail. And fortunately, I've also been really, really lucky in my life. I've been very fortunate in my life. I'm able to choose some really good people to be around me. And, I can't say we've always been 100% successful, because we've had to redo some things a couple of times. But when I bring somebody on board, whether they're UX or coding or database structuring or developing security techniques and methods so that we provide privacy and security of this really important information. You vet them. You vet them with other people that know how to vet better than you do, and you trust them enough to do what they do best. Right? So I think about it like in medicine. I'm an internist. I will never personally remove your gallbladder, not me. But I know the guy who can take your gallbladder out today, and you'll be back in your chair tomorrow eating a sandwich. I promise you, he's that good. Mm-hmm. So, and I don't need to know every intricacy of every angle of every cut that he needs to make to do this, mm-hmm. but I know that he can do it. And I think that's where I've been lucky. I've been lucky.
Great. Thanks for elaborating on that. Thank you.
I really love that. It's brought to light this idea that people tend to build new products or new companies based on years of experience and knowledge or understanding of a particular industry or marketplace. And here we are. Sometimes a little naivety can actually make it so that you think that what is difficult isn't. And you push the envelope for people who normally would say, this is really hard to do, but in your mind, it's like, no, it's not. Let's just get it done. So maybe there's a lot to be said about having, people that not necessarily come from a specific space who can bring experience and at least the sort of wherewithal and desire and passion to make things happen. So congratulations for doing that.
This strange paradox of being naive and wise at the exact same time. Like,
right.
Yeah. That's
Right.
great. So, Marc, I know that we're coming to the end of our show already today. And one of the things that I was wondering is, I personally see some great implication here. You shared with us a very personal story about your mother early in the show. And what I see here is implications of saving a lot of time. And as most of us know, in medical emergencies, time is life, right? Seconds matter. So if we can make these very quick transfers of information, I can see the implications there on patients' healthcare and well-being. I also see reduced costs, right? In healthcare, you mentioned, God, we just ran these tests 5 miles from here. Now we have to run these tests again. So long term, how do you feel that ChartDoc might be able to impact the healthcare industry as a whole?
I think, there's so many ways it could impact, but the first thing that comes to my mind in answering you is just the horrific fact that there's about $80 billion per year, according to the government, just in fraud. And if you can just imagine just fraud. If you can imagine that anytime, a doctor does something on you, here we are, pulling this information to tag it to your body because you own your information. Now, all of a sudden, you as the patient are realizing that, tests X, Y, and Z are done on you. The amount of money that's just committed on fraud, just for CMS, just for Medicare and Medicaid, exceeds $80 billion a year. $80 billion a year would literally fix the problem that we have of the millions of people who are uninsured. I mean, it would be enough money to solve that whole problem. I also see it as a research tool. If you just take pancreatic cancer as an example, clearly 1% of people survive. Well, it's not just luck that somebody survives. There's some commonality. There's something, whether it's something genetic, whether it's something that's done to them, whether it's something about their chemo that they receive. And because individual medical information lives in silos right now, and they don't talk to each other. If you can imagine, instead of looking at a population of 10,000 pancreatic cancer patients, maybe you're looking at a population of 100,000 over a course of a 10-year period. Now you can actually readily identify what treatment's going to work for whom, and if you really want to impact the situation, and at what cost. So I believe there's money to be saved for insurers. I believe there's money to be saved reducing fraud, and I think there's enhancements and improvements to be made in the treatments of cancer care and other medical problems just by having all this information be able to be de-identified and then analyzed. And that's really my ultimate vision for ChartDoc. Really
de-identified, excuse my ignorance, meaning I take someone's private information, make them anonymous, mix it up with everyone else's, and then extract that data.
Right. So all of the Kim Lantis information and the Marc Polimeri information and the Carlos Ponce information, our names, our identifiers are removed from them, yet our information is valid and may in fact benefit not only us, but may in fact benefit proper analysis someone else.
Mm-hmm.
Well, it sounds like just like HIPAA was passed in '96, maybe we need some legislative push to adopt this kind of technology across the board. So there's collaboration and knowledge sharing and improvement across the scientific community. So we're up on time. We wish you a lot of success with it, and we hope to hear back from you in the near future and more use cases as you go post launch. And definitely see a lot of potential for this. It's timely and needed. So thanks for doing what you're doing and for being with us today. And that's a wrap for today. Just stay with us as we go off the air. Come back Monday at 1 p.m. Pacific. We're going to have the recap show. We'll recap the shows from this week in 10 minutes. And if you'd like to participate, if you watch the show, enjoy the show, and you want to add your own commentary to what you've seen and what you've learned, you can be one of the Brady Bunch squares here. Just comment wherever you're watching. We'll see those comments and we'll invite you to join us. We are completely open to making that happen and welcome that. And we're still waiting for someone to take us up on that. We've had a couple of people taking us up on that, but many people, I guess they're shy. Just don't be shy. Come on here. We don't bite.
Oh, yeah.
Exactly. And then what do we got coming up
Not
next
hard.
week? Besides the recap show, Carlos?
Well, yeah, besides the recap show, Tulio, on Tuesday, we're going to be speaking with Sue Ellen McFarling from Leonardo 247. And then on Wednesday, Nick Jordan at Narrative.io. That's the name of the company. And finally, on Thursday, we'll be speaking with the CEO of ProCep, Mr. John Savy from ProCep. So these companies are all. I don't have the specifics on regarding the verticals or the spaces. As you know, these days it's taking a little bit longer than usual to get the info from the guests. But I mean, it's predictable. It's a slow down season. I mean, that's okay. But they're all going to be interesting, Tulio. They're all going to be tech companies or platforms with really cool ideas and value propositions for the world. And I encourage everyone from the viewers to join us next week right here on Dojo Live at 1 p.m. Pacific.
Stay safe, everyone.